Hey everyone, Certified Lymphedema Therapist here. Let's go step by step through a lymphatic drainage routine to help move fluid for lower leg, ankle, and foot swelling and lymphedema. If you want printable handouts, check out the links in the description box down below. So we're going to dive right in, but if you have any new symptoms or pain, always check in with your doctor for clearance for safety. It's also best to do this routine directly on the skin if you're able to. And this is something that can be done daily. Everyone is going to need to find a different position that is comfortable for them, but if someone has issues reaching their legs or feet, then pulling in a friend or family member might be helpful. So first we're starting with 4 deep breaths to stimulate the deeper lymphatic structures. This will increase flow of the lymphatic fluid through the large vessels. Placing your hand on your abdomen, gently pressing inward, taking a nice big deep breath in through your belly, and then out. Then we want to stimulate the lymph nodes that are right around the collarbone or the clavicle area, as all of the fluid in the legs and in the body go to this area before moving back to the heart. So putting your hand on this area and doing 8 to 10 circles on both sides. Then we want to stimulate the lymph nodes that are right below the ear and around the jaw and neck. So putting your hand on either side, using your whole hand, doing 8 to 10 circles there. Next, we want to stimulate the lymph nodes that are in the armpit area, putting your hand directly in the armpit and doing 8 to 10 circles before doing the same thing on the opposite side. Finally, we want to stimulate the lymph nodes that are right in the groin area called the inguinal lymph nodes, doing 8 to 10 circles in either direction, right about where your sitting crease is. Then we're going to try to start with the right side, guiding the fluid from that low back area, wrapping it around towards the lymph nodes right in the front. You can either do this all in one side or do both sides at the same time. All the fluid from the bottom, the low back, and into the hip will wrap around towards the front. Then we'll start to work down the leg, starting with one leg, starting at the knee and working our way up towards the lymph nodes in the groin. You're going to use as much of your hand as possible and guide the fluid up gently, doing 3 to 5 strokes on each area or each side of the thigh. As you get to the back of the thigh and the sides, you want to start to wrap that fluid around towards the front where those lymph nodes are. And this will ensure that the fluid is moving in the correct direction. Next, we want to stimulate the lymph nodes that are right behind the knee. So doing a few circles behind the knee. Then also making sure that we work in the front of the knee, guiding the fluid around the bone, around the kneecap, and into any crevices that might be holding fluid. Then we'll work into the lower leg, finding a position that works for you to reach as much of your leg as possible, working from the ankle all the way up to the knee. 3 to 5 strokes on each side of the lower leg. All of the fluid in the lower leg can go straight up because, again, you have lymph nodes that are behind the knee that can assist with the back. Then we want to work around the ankle bone and into the ankle. A lot of fluid likes to sit around the bones and in the crevices. So spending time with your fingers there can be helpful. Then we work onto the foot, using your whole hand on the top of the foot, as well as into the toes. If you have more swelling in your toes, you can spend time with each toe individually before moving on. After you finish with the foot, you can work back up into the ankle, and then back up into the lower leg. Repeating the same thing, doing 3 to 5 strokes, working from the ankle all the way to the knee. Making sure that we get all sides, or again, as much as someone can reach. It's ideal to use as much surface area of your hand as possible to be the most effective. After spending as much time as someone would like in the lower leg, then we move back up to the knee, guiding the fluid around the bones, from the crevices, and then making sure we get behind the knee, working around those tendons and re-stimulating those lymph nodes. Then we'll work back to the thigh, working from the knee all the way up to the groin area, working towards the lymph nodes in the front. 3 to 5 strokes on all sides of the thigh. Again, as you work onto the sides of the thigh and even into the back of the thigh, start to wrap that fluid around towards those lymph nodes in the front. If someone has a troubled area or has a pocket of fluid, they can spend more time in that area. But then when they're ready, going back into the hip and the glute and the low back, guiding that fluid towards the front and in the groin. Then we can repeat the same thing on the opposite side, starting with the low back and the hip and the glute, rotating and guiding the fluid around, wrapping it around towards the lymph nodes in the front before moving on to the thigh. At the thigh, go from the knee up towards the front of the hip. 3 to 5 strokes on each side, nice and gentle. If someone has thicker or more hardened tissue, that can be what we call fibrosis from fluid sitting there a long period of time. They can spend more time in that area, massaging that area out, softening it up before moving on. Make sure to go back and re-stimulate the lymph nodes, doing circles behind the knee, and then also working the fluid from around the knee, around the kneecap, and on the sides of the knee. Then working from the ankle to the knee, going straight up. 3 to 5 strokes on all sides. If someone is able to get their leg above their heart, maybe doing this laying down, gravity can assist in moving the fluid a little bit easier. But in the end, finding a position that works best to reach the leg, or as much of it as possible, is ideal. After finishing with the lower leg, then we go into the ankle, working around the ankle bones, around the tendons, and also into the back of the ankle, spending time in any troubled areas, especially around the bones, before moving on to the foot. Massaging up on the top of the foot as well as working into the toes. Again, spending more time on the toes if needed before moving on. Then we're going to work in reverse, working the fluid back up. Working into the ankle, and then guiding the fluid up the lower leg. Three to 5 strokes on all sides, and spending more time in an area that might have more fluid. After the lower leg is done, then we'll work back up into the knee, getting that fluid around the tendons and behind the knee, on the sides of the knee, as well as around the front, spending time working around the bones. Then working back into the thigh, guiding the fluid from the knee up towards the front of the hip. 3 to 5 strokes on all sides. And remember, as you get into the back of the thigh or on the sides, start to wrap that fluid around towards the front to get that fluid moving. Then finish with the hip and the glute and into the low back again, wrapping the fluid around towards the front. We can re-stimulate the lymph nodes that are in the front of the hip and in the groin area. We can also move the fluid up the side of the body towards the lymph nodes in the armpit area on both sides. If someone's had lymph nodes removed in their groin, this would be a great step. If someone has a healthy lymphatic system overall, this might not be as necessary. We're going to finish with 4 more deep breaths, putting your hand on your abdomen, gently pressing inward for some pressure, Take a nice big deep breath in through your nose and then exhale out through your mouth. And repeating 3 more times. And that's a full sequence for lymphatic drainage to the lower leg, ankle, and foot for swelling and lymphedema. Again, be sure to reach out to a doctor or a certified lymphedema therapist for more personalized guidance. I hope you all found this video helpful. Be sure to check out the other videos and playlists for more resources. Thanks, everyone.